Hi, everyone. I'm Danae Jones, your local representative for Global Financial Partners, the one stop shop for all your funding needs. I'm excited to connect with you today and pleased to always support the incredible work you all do in the personal injury space. I'm also proud to share that Global Financial Partners sponsors PI Today podcast, helping bring valuable insights and medical education to our community. And don't forget to like, comment, follow, subscribe, and share this episode. See you all next time.
Good afternoon. I'm your host, Dr. Nick. Welcome again to PI Today's podcast on this beautiful summer Californian day. Today, we are joined by a specialty that is around, but a lot of people don't know exactly what the specialty is. You guys use them and might refer to them for other types of treatment, but to pinpoint this specialty, our guest is going to talk to us about what is this particular specialty. And we're joined today here by Dr. Max Moradian, MD, PM&R. Doctor, welcome to PI Today.
Thank you so much, Dr. Ole. It's been a while that you've asked me to join the podcast, and finally I couldn't say no after many times, and I'm here. I
Yes,
would love
thank you.
to collaborate.
A long drive from Glendale, I would imagine.
Yes.
Yes, yes, very long drive. So, Dr. Moradian and I are old friends. He's very much so an academic. And, Doctor, can you tell us what is exactly a PM&R, what you do? Because I know there's it's a vast specialty, and then some PM&R doctors narrow it down or either expand it. So, can you go into what PM&R is, how you got here, what's the fellowship like?
Yeah, so even a lot of patients and other physicians that refer to us still sometimes ask me the same question: what exactly is PM&R? PM&R stands for Physical Medicine and Rehabilitation. The other terms for a PM&R specialist is physiatry or physiatry. And the specialty is one that started after the around World War II, and is the specialty that is mostly interested in improving the patient's physical impairments and quality of life, as opposed to finding a specific cure to manage these impairments or handicaps. It's a specialty that involves the brain, the spinal cord, nerves, muscles, joints, ligaments, and tendons. So a physiatrist has to be very well rounded in all of these areas. And also, our goal is to improve the patient's independence from their activities of daily living and their quality of life. So one other way I explain to patients or physicians is that I'm a quality of life doctor. So our job is to make a patient with impairments have a better quality of life.
And I know PM&R has a lot of branches. And these branches, I've seen PM&R do diagnostic testing like EMGs and NCVs. I've seen PM&R doctors do pain management, and they're wonderful at it. I've seen PM&R doctors do traumatic brain injury and rehab. So, which branch is your branch?
Yeah, so my branch is I did two fellowships. One was sports medicine, one was interventional pain management. But I also specialize in traumatic brain injuries. And going back to a previous question you asked, the residencies in physical medicine and rehab are about 3 to 4 years long, depending on whether you do a internship or a preliminary year, and then you do the residency. But after residency, you have a lot of options of fellowships. Other fellowships include spinal cord injury, pediatric specialties, and doing that. Besides sports medicine and pain management and brain injury, there's also fellowships that are looking at burn rehab, and in my capacity, I see patients that have some sort of pain management needs. But I also, for example, do electrodiagnostic testing. So if a patient of mine has pain, whether it's coming from their neck or their lower back, for example, I could also do a nerve test or nerve conduction study, EMG. And some physiatrists, for example, work in a hospital setting and do inpatient rehab. So most of my practice is in the outpatient setting. And again, pain management, sports medicine, and brain injury are the top three.
So what's great about Dr. Moradian, it's pretty much for in the personal injury world, he's a one-stop shop where he takes care of your pain management needs, which is epidurals, facets, spinal cord stimulators, things that your anesthesia pain does or your neurology pain does. But he also specializes. Now, a lot of people don't know this, but the subspecialty in traumatic brain injuries, one of the top specialties is PM&R because that's who takes care of their care and diagnosis. Um, a lot of people think it's neurology. They also do it, but the neurologist sends it to the PM&R to be rehabbed and to do all these type of things. So I've noticed that Dr. Moradian's diagnosis and treatment of TBIs are second to none. And meanwhile, I haven't seen too many patients with TBIs that do not have any musculoskeletal pain, neck pain, low back pain, disc herniations, facet syndromes, you name it, radicular pain. Um, so that's what's great about Dr. Moradian is because you can send your clients or your patients to one location for the proper diagnosis and some obviously needed treatment. So, and you're not going to find too many pain guys that will do a needle EMG and nerve conduction test to find out to give you positive objective findings about radicular pain. So it makes him a very highly trained, skilled physician where you save time on your patient's office visits and get everything done with a great academic. So um, that's fantastic, Doc, because we don't have too many specialties that do all in one like you do.
Yeah, thank you for the compliments, Dr. Lule. I think it really always goes back down to the patient care. You hit it on the nail about patients being a little frustrated in the medical system, in my opinion, whether it's in the personal injury space or outside the personal injury space. Patients get tired of explaining their symptoms and to multiple specialists that are not communicating within each other. There's a lot of multidisciplinary care. However, sometimes there's not interdisciplinary care. So, physiatrists, one of the other, as a whole, a lot of us are really good at collaborating and sort of quarterbacking a patient's management. And that stems from us learning how to be team players in a rehab setting where there's occupational therapists, speech therapists, physical therapists, neuropsychologists, case managers, or social workers that are involved in helping these patients that have an impairment or a disability reach their functional goals. So one point for physical medicine rehab specialists is that we're really good collaborators, and the patient hopefully doesn't get frustrated in explaining their symptoms. You also mentioned diagnostics. In my opinion, I think what's a problem in the medical system now is people get a lot of diagnostic tests, but there's not one specialty to put all of these tests together in order to come up with a proper treatment regimen. And so, the same way a pain management patient comes in and has multiple symptoms, uh, if the physician is really interested in the diagnostics, they'll they'll be able to arrive at a better treatment. A lot of treatment that is scattered is because the diagnosis has not been correct. And for example, in a pain management situation, the pain generator has not been determined. And you mentioned things like cervical facet syndrome or other neck injuries. I do feel that a lot of brain injury, we forget that there's also concomitant neck injury.
Absolutely.
And the statistics do mention that severe TBI cases have about a 50% involvement of spinal cord injuries.
Absolutely.
And so the patients that are ending up in hospitals for 3 months, 6 months in an inpatient rehabilitation setting, a lot of them don't just have TBI or SCI or spinal cord injury, they have both. And for even a mild TBI or a concussion, I always look at the neck exam and I don't defer that to a spine surgeon, a neurologist, or even a specialist such as a chiropractor, physical therapist, or any therapist. I make sure that we examine the cervical spine along with a brain injury exam and vice versa. Anytime there's a brain injury exam, we're looking at the neck. Anytime there's a neck exam, you should look at a brain, do a cranial nerve exam to make sure, for example, they don't have a loss of smell, and that would cue you into a possible brain injury.
Correct. Um, so tell us about, do you do permanent stems? Do you do trials? What kind of spinal cord stimulators do you do?
Yeah, so I actually, I'm one of the pain management physicians that mostly believes in doing the testing for spinal cord stimulator trials. I consider it a very diagnostic test for the implantations of spinal cord stimulators, or even now, a lot of conditions that we would utilize spinal cord stimulator therapy. We're now using the peripheral nerve stimulators. And I do the trials of spinal cord stim and usually refer out to a surgeon to implant them. I do believe that the surgeons that implant them do a better job and make sure that the paddles are not migrating. But with peripheral nerve stim, usually that's something that the pain management specialist is doing. But again, there are a lot of really good pain management specialists that are doing the trials and the implants,
Sure.
and we're all comfortable with. I always say to a lot of the younger generation of doctors that come out, and we train a lot of residents and medical students. Know what you know and know what you don't know, and if you don't know, find someone that knows the information better than you. And if you take care of everyone like your mom, assuming you love your mom, you'll always be a successful physician. So, and one of the toughest things that physicians have a tough time mentioning is what they don't know. And I a lot of times tell my patients or referring providers, that's not something that I know, but X, Y, and Z doctor does. And so
Perfect.
that's ultimately the best thing for our patients, because at the end of the day, we're here for our patients, and that's what we're patient advocates ultimately.
Perfect. And one of the conditions like CRPS, that's something that goes to pain management. Obviously, something that you take care of, whether it's pain management needed or spinal cord stimulator, something you diagnose and also treat. Correct?
Yes, and actually complex regional pain syndrome, which has two types, type 1, formerly known as reflex sympathetic dystrophy, or type 2, formerly known as causalgia, is one of those diagnoses that actually brings about all of what a physiatrist or PM&R specialist strives for and does well, because there's a significant component of not only the pain management angle, but also psychosocial. A lot of these patients have significant quality of life impairments, and we get tested on oral board exams for complex regional pain syndrome all the time, because we have to know what medications help them, what kind of rehabilitation options and modalities there are. Do diagnostic procedures. One of the diagnostic procedures is a stellate ganglion block, which could be done under ultrasound or X-ray to block the nerve supply in the neck area that potentially can be downregulated, or the lumbar sympathetic block in the lower back. So these diagnostic tests sometimes are used as therapeutic injections as well, but they're very good diagnostic tests to decide on what the diagnosis is before moving on to something more permanent, such as a spinal cord stimulator trial or a peripheral nerve stimulator trial.
Correct. So, guys, we covered a lot today. Just remember, Dr. Maxim Moradian, your pain management, epidurals, facets, your diagnostic testing, your EMGs for radicular pain, your TBI diagnosis, huge, PM&R, and CRPS. So, Doc, thank you for bringing all your knowledge, all your specialties to the personal injury world and helping all the patients and clients out there. Where are you located, Doc?
Yeah, so we're located in Glendale, Arcadia, and Palmdale, California. We have 2 physicians in our group. Dr. James Liu, who is also a physiatrist and did the same fellowship that I did in interventional pain and sports medicine. Trained at Casa Colina. I did my residency in Louisiana State University, did my medical school at Penn State, but we have the same fellowship mentor. And one other thing that you mentioned, I really want to do focus on every specialty has its niche and its necessity. And so I don't want to claim that we're the best at anything. The neurologists have a really good role in the acute management of brain injury, neurosurgeons, and even just in pain management as a whole. All of the therapists, PTs, OTs, chiropractic doctors, everyone is, as an acupuncturist, everyone's integral in the rehabilitation process.
Absolutely.
And I think that at the same time, I believe that we're that one specialty, and I have a significant passion. And I know you asked how I got to choosing the field of PM&R. It's because I actually was involved in an incident, and I had my own disabilities, I had my own pain, and I felt that the medical system was a little scattered. Saw an orthopedic surgeon, saw a chiropractor, saw a physical therapist, but I didn't have that one physician that put it all together. And so I think that as physiatrists, I have a passion for it, and I would love for every physician and every patient to know what PM&R is. We are this one specialty that helps quarterback patients that have disabilities and impairments.
Correct. Well, thank you for joining us today. That is a wrap, and I'm sure we're going to have you back later on to pick your brain, but that's all the time we have today. And guys, stay tuned for the next physician or next provider on PI's Today's podcast. See you later.
Hello, you guys. I'm Tony, your Trauma Cash president. I'm excited to connect with you and support the incredible work you do in the personal injury space. And also, I'm very proud to share that Trauma Cash sponsors PI Today podcast, helping bring valuable insights and medical education to our community. Don't forget to like, comment, follow, subscribe, and share this episode. Enjoy the podcast and see you guys next time.